Assalamu alaikum, welcome to VetLec. Today I am going to discuss the anatomy of humerus of dog. Humerus is a type of long bone which is present between the scapula and radius ulna. It has two extremities, one is the proximal extremity and other is the distal extremity. Between these two extremities there is a long body or shaft which is roughly cylindrical in shape, and this shaft or body has twisted appearance and it is spiral in shape. The body of the humerus contains four surfaces. One is the lateral surface, one is the medial surface, one surface is the caudal surface or posterior surface, and fourth surface is the cranial surface or anterior surface. First I will discuss the proximal extremity of humerus. If we see the proximal extremity of humerus, then a most prominent feature is present at the caudal aspect of the humerus. It can be easily distinguished from the caudal aspect of humerus, and this structure is called head of humerus. This head of humerus is convex and smooth structure which can be easily distinguished at the caudal aspect of humerus. Then two tuberosities are also present at the proximal aspect of humerus. One is the lateral tuberosity which is present at the lateral aspect of humerus, while the other is the medial tuberosity which is present at the medial aspect of humerus. The lateral tuberosity is also known as greater tubercle as it is greater or larger than the medial tuberosity. So the medial tuberosity is also known as lesser tubercle. If we talk about the muscular attachments of the greater tubercle, then three types of muscles are inserted here. One is the supraspinatus muscle, infraspinatus muscle, and third muscle is the part of deep pectoral muscle. So these three muscles are inserted at the greater tubercle or lateral tuberosity of humerus. If we talk about the muscular attachments of the medial tuberosity of humerus, then at this tuberosity, subscapularis muscle is inserted. Now between the greater tuberosity and lesser tuberosity, there is a bicipital groove or intertuberal groove. This intertuberal groove is directed craniomedially. As you can see in the structure that it is present cranially and somewhat medially, as it is the medial aspect of humerus and this is the cranial view of humerus. So this bicipital groove is directing towards the cranial aspect of humerus, and it is actually present at the medial aspect of humerus. So you can also see it from here. This is the cranial aspect of humerus and this is the medial aspect. This is the caudal view of humerus. So this groove is present medially and somewhat cranially. Now between the head of humerus and between the lateral tuberosity of humerus, many nutrient foramens are present, as you can see in the structure in the picture. So these nutrient foramens are present here. If we talk about the muscular attachments of the bicipital groove, then the tendon of bicep brachii muscle is present in this intertuberal groove. Just distal to the head of humerus at the caudal surface of humerus, a constricted region is present which is called neck of humerus, and it is clear at the caudal aspect of humerus. Now let's talk about the surfaces of humerus. If we talk about the lateral surface of humerus, then it contains a line which is known as tricipital line, and this tricipital line actually starts from the greater tubercle laterally, and this line continues to move cranially until it ends at a tuberosity which is called deltoid tuberosity. Now see here, this is the greater tuberosity or greater tubercle or lateral tuberosity of the humerus. This is the tricipital line. It is starting from this greater tubercle and it is continuing to move towards cranial aspect of humerus, and it is finally ending at a tuberosity which is called deltoid tuberosity. So this line is the tricipital line of humerus. Another tubercle is present on this lateral surface of the humerus, just proximal to the deltoid tuberosity, and this tuberosity is called teres minor tuberosity, which is present here. Now if we talk about the muscular attachments of this teres minor tuberosity and deltoid tuberosity, then deltoideus muscle is inserted at the deltoid tuberosity, while lateral head of tricep muscle originates from the tricipital line. Lateral head of tricep muscle originates from this tricipital line, while teres minor muscle is inserted in the on the teres minor tubercle. Now another structure is also evident on the lateral aspect of the humerus, and that structure is the musculospiral groove, or this musculospiral groove is also known as brachialis groove. So this musculospiral groove starts from the neck of the humerus caudally, from the caudal aspect of humerus, from the neck region. This musculospiral groove starts from the neck region caudally, then it continues to extend at the lateral surface of the humerus, and finally it bends cranially at the distal aspect of humerus. You can be more clear. Yes, this is the neck of humerus. So this musculospiral groove is actually starting from this neck of humerus caudally, and then it is continuing to move laterally, and it is extending laterally here, and then it continues to bend cranially from the distal aspect of humerus. So here, this one. Yes, this musculospiral groove, now it can be more clear. This is starting from the neck, then it is extending laterally, and finally it is bending cranially, as it is the cranial view of humerus. This all is the lateral view, and this is the caudal view. This musculospiral groove contains brachialis muscle, and therefore this groove is also known as brachialis groove. Now let's talk about the medial surface of the humerus. Medial surface of the humerus is flat, and it is roughly triangular in its proximal half, while it is rounded distally. So you can see that it is nearly triangular proximally, while it is rounded distally. This medial surface of the humerus also contains a tuberosity, which is proximally, which is called teres major tuberosity, and this teres major tuberosity is at the same level, at the same transverse plane as the deltoid tuberosity. So deltoid tuberosity is present here, and at the same level teres major tuberosity is present on the medial surface of humerus. Now if we talk about the muscular attachments of this teres major tubercle, then two muscles are inserted at this tubercle. One is the teres major muscle, and other is the latissimus dorsi muscle. Now just proximal to this teres major tuberosity, two more muscles are present. One is the medial head of tricep muscle, which originates from its proximal part, and other is the coracobrachialis muscle, which is inserted here. So coracobrachialis muscle is inserted, and medial head of tricep muscle originates from the proximal, just proximal to the teres major tuberosity. Now let's talk about the cranial surface of humerus. The cranial surface of humerus is irregular, wide and smooth proximally, while distally it is narrower and roughened. So it is wide and smooth proximally. This is the greater tubercle of humerus. This is the deltoid tuberosity, and this is the lateral view. This is the cranial view of humerus. So the proximal part of the cranial surface of humerus starts from the crest of greater tubercle. This is the greater tubercle, and this is the crest of greater tubercle, and this is the tricipital line, and this is the deltoid tuberosity. So the proximal part of the cranial surface starts from this crest of greater tubercle, and this crest of greater tubercle passes medial to the deltoid tuberosity. This is the deltoid tuberosity, and finally it reaches the musculospiral groove. This is the musculospiral groove, and in this way it forms crest of humerus, which is the prominent border which can be seen on the cranial surface of humerus. Wait a minute. Yes, now see here that this is the crest of greater tubercle. This all is the crest of greater tubercle. This one is the deltoid tuberosity, and this is the tricipital line. So this crest of greater tubercle, cranial aspect of the proximal aspect of the cranial surface of humerus is starting from this crest of greater tubercle. This crest is moving to medial to the deltoid tuberosity, and finally it is moving towards the crest of humerus. This is the crest of humerus, and here finally the musculospiral groove is ending distally at the cranial aspect of humerus. So you can see that this crest of greater tubercle finally reaches the crest of humerus. Sorry, this crest of greater tubercle reaches the musculospiral group, and finally it forms the crest of humerus here. Now let's talk about the caudal surface of humerus. If we talk about the caudal surface, then it is smooth and it is rounded side by side. This caudal surface of the humerus starts proximally from the neck of humerus and ends distally at the supracondylar crest. So it ends distally at the supracondylar crest. A nutrient foramen is also present here on the caudal surface of humerus. So here the nutrient foramen is present. So this was all about the surfaces of humerus. Now let's talk about the distal extremity of the humerus. If we see the distal extremities of the humerus, then the first feature that we see cranially is the radial fossa. So this radial fossa is present at the distal extremity at the cranial aspect of humerus. And similarly at the caudal aspect of humerus, at the distal extremity of caudal aspect of humerus, there is another fossa which is known as olecranon fossa. And between this olecranon fossa and radial fossa, there is a foramen which is called as supratrochlear foramen, and it interconnects these two fossae. Yes, this one is the olecranon fossa, this one is the olecranon fossa, and here we have radial fossa here. This is the radial fossa, all is the radial fossa. And these both fossae are interconnected by this foramen. This is the foramen which interconnects these olecranon fossa and radial fossa. Then cranially, if we see the distal extremity cranially, then we see two condyles which are separated by a low ridge. This is the low ridge which is separating. This low ridge is separating these two condyles. So one is the lateral condyle and other is the medial condyle. Lateral condyle is larger than the medial one. This is the lateral condyle, and here this is the medial condyle. So lateral condyle is greater than the medial condyle, and lateral condyle is called as capitulum, while the medial condyle is known as trochlea. Now these condyles continue to move caudally, and at the caudal aspect they end at supracondylar crest. So this is the lateral supracondylar crest, and it is present caudolaterally. This is the caudal view, and this is the lateral view. So it is present caudolaterally, this crest, supracondylar crest. It is present caudolaterally, and if we talk about its muscular attachments, then two types of muscles originate from this supracondylar crest. One is the extensor carpi radialis muscle, and other is the part of anconeus muscle. So these both muscles originate from this supracondylar crest. At the sides of both condyles, two epicondyles are present. So two epicondyles are present. One is the lateral epicondyle and other is the medial epicondyle. The lateral epicondyle is smaller than the medial one, as you can see here. This is the medial epicondyle, and it is larger than the lateral epicondyle which is present here. If we talk about the muscular attachments of the lateral epicondyle, then four types of muscles are present at the lateral epicondyle, and one ligament is present here. These muscles are the common digital extensor muscle, lateral digital extensor muscle, ulnaris lateralis muscle, and supinator muscle. The ligament which is present at the lateral epicondyle is called lateral collateral ligament of elbow. If we talk about the muscular attachments of the medial epicondyle, then five types of muscles are present here. One is the flexor carpi radialis, flexor carpi ulnaris muscle, superficial digital flexor muscle, deep digital flexor muscle, and pronator teres muscle. And the ligament which is present at the medial epicondyle is called medial collateral ligament of elbow. As flexor muscles are present at the medial epicondyle, so this epicondyle is also known as flexor epicondyle. And as on the lateral epicondyle, extensor muscles are present, so this epicondyle is also known as extensor epicondyle. So this was all about the anatomy of the humerus of dog. Thank you. If we talk about the muscular attachments of the greater tubercle or tuberosity or lesser tubercle or tuberosity of the humerus, then at the greater tuberosity or lateral tuberosity of humerus, three types of muscles are inserted. One is the supraspinatus muscle, one is the infraspinatus muscle, and third is the part of deep pectoral muscle. Similarly, at the lesser tubercle, subscapularis muscle is inserted.